Thank you, everybody. Thank you, everybody. I'm really happy to be here today. Very, very grateful to Governor Braun and to Mehmet Oz. But I've been to a bunch of states to announce MAHA initiatives over the past 3 or 4 weeks, and it's always been one at a time. And this one really broke the bank. 9 executive orders, all designed to improve our farms, our fitness, our food, our education, our health. And you know, I had the pleasure to meet with many of the legislatures in the state just now and with Governor Braun. And I was so impressed by the high caliber of the people there, the level of intelligence, the level of thoughtfulness, the commitment and the idealism in that room. And I have just nothing but optimism for the state of Indiana because of that leadership. We're in a crisis today. We're about to announce new autism numbers. They've again gone up dramatically just in 2 years. We have in some states as low as, well, 1 out of 20 boys having autism, 1 out of 31 kids. And when I was in my generation today, the rate of autism is 1 in 10,000. And this is just one disease. This whole generation of kids is damaged by chronic disease. I was talking to the governor that I walk through an airport and I see these young people who once again have hope because of what's happening in this administration. But you know, you can see the chronic inflammation, you can see the mitochondrial challenges that they're facing. And this is not, you know, as the governor mentioned, diabetes is a treatable disease. Virtually 100% of people who are pre-diabetic can get rid of that diagnosis through changes in their diets. And so it's treatable, and if 50% of our adults, when I was a kid, the typical pediatrician would see 1 case of diabetes during his lifetime, during a 40 or 50-year career, juvenile diabetes. Today, 1 out of every 3 kids who walks through his office door is diabetic or pre-diabetic. We just got new numbers from NIH that said that 38% of teens are pre-diabetic. We have 100 million people in this country who are pre-diabetic. This is unknown in human history. And, you know, obesity crisis, when my uncle was president, 3% of Americans were obese. Today, it's around 70% are obese or overweight. In Japan, when my uncle was president, 3% of kids were obese. Today in Japan, 3% of kids are obese. So it's a choice. And it's almost certainly because Japan has a very, very aggressive school lunch program. And make sure the kids get wholesome foods. And when you raise these children, as Mehmet said, when you raise them, they become advocates for good food. They become energized themselves, and they develop lifelong habits. Their taste buds are altered so that they have a yearning and a hunger for good food and a repulsion towards food that is making us sick. Today, we're the 4th most obese country in the world, and we have something that is unique in human history. We have people who are obese who are at the same time malnourished, because the food that we're eating is not nutrient dense anymore. And I was involved, you know, in tobacco litigation back in the 1980s, in the late 80s, and the tobacco companies at that point were the most cash-rich companies on earth. And they saw the writing on the wall. They saw the regulatory headwinds, and their consumers were walking away from their product, and they decided to diversify. So they started buying up the food companies. By the mid-1990s, the 2 biggest food companies in the world were R.J. Reynolds and Philip Morris. And they transferred thousands of scientists that were engaged in making tobacco more addictive to do the same thing with food. And they developed in the lab all of these chemicals that are unknown in nature, that make food more attractive. It's not food, it's food-like substances. So they'll put a strawberry flavor in the food, but there's no nutrients that you would find in a strawberry. Your body is craving that, but it doesn't get filled up. And it doesn't give you nutrition, but you want to eat more and more, so you get obese, but at the same time you get malnourished. And they put addictive substances like sugar and sodium and others, monosodium glutamate in our foods, that make you so that you don't get satiated and that you constantly want to have more. They realized at some point through all these, that they could hijack the human brain in all these nefarious ways. But one of them is that they realized that one of the ways that your brain tells your stomach that it's full is how many times you chew. Oh, they began adding food softeners to our food so that your brain would be under the illusion that you weren't full. You can inhale 20 Twinkies and still want more because you're not chewing them. And so they figured out all these things, and they changed our food system in this country, so it is poison to us. And it is poisoning the American people. My uncle, as Governor Braun said, launched the Presidential Council on Physical Fitness back in 1961, and because he saw the healthcare costs increasing, but he also saw, more importantly, that our country, Americans, when I was growing up, were regarded as the toughest people in the world. And he associated that beef jerky toughness that was associated with the American people in the minds of the rest of the world with the success of our nation. And he didn't want us to get soft. And when Governor Braun and I were growing up, we all participated in the Presidential Council and the fitness tests, and it was a big aspiration at our schools to do that. And for me, it imbued me with a lifetime commitment to physical fitness. And today, I'm 71 years old, and the governor is the same, and he, both of us feel like we're in our 40s or 50s, and we have a lot of energy and a higher capacity to enjoy our lives. And we want that for our children, and we all want it. We now have the sickest country in the world. We spend 2 to 3 times for health care what other countries spend, and we are the sickest nation. We had, during COVID, the highest death rate of any country in the world. We had 16% of the COVID deaths in this country, and we only have 4.2% of the world's population. And that's because we have these comorbidities, this chronic disease that the CDC said the average American who died from COVID had 3.8 chronic diseases. Healthy people were not dying. It was sick people who were dying. They were already sick. And so if we want to protect our country against infectious diseases, we need to start by making people healthy again. And President Trump, who I'm very, very grateful for, because he's given me this opportunity and given Dr. Oz this opportunity, he often says that he wants to make America strong again. But we can't be a strong nation if we're not a strong people. He says that he wants to restore the American dream, but a healthy person has 1,000 dreams, and a sick person only has one. And today, 60% of the people in this country have only one dream. It is threatening our national security. 74% of our kids cannot qualify for military service. And it's destroying our economy and our national vigor. We're spending when my uncle was president, we spent 0 on chronic disease, 0 in this country. They were spending about $1.3 trillion a year, and we can't afford it. And we have to figure out new ways to make America, to allow Americans to take responsibility and agency for their own health. But we also need to, we need to change our food system in this country so that we start giving our kids foods that are going to actually make them healthy and imbue them with vigor and ambition and a dream. Oh, I want to thank again Governor Braun. I also want to take this moment to encourage governors all over the country to follow the lead of Indiana and to file with Brooke Rollins, who's my partner in this, in MAHA, head of USDA. She is right now, at this very moment, in Arkansas with Governor Sarah Huckabee, announcing the application for SNAP waivers for sodas in that state. This is the first state that has added candy to the SNAP waivers. I'm very, very proud of you, Governor, for doing that. I look at Governor Braun as a really important partner in the MAHA movement, and a great leader, and I'm very, very grateful for you taking this very ambitious steps that you've taken today. And not only that, I'll say this, there's a couple of states that I've been to where we've announced SNAP waivers, but we haven't seen the SNAP waiver application yet, and Governor Braun's SNAP waiver already went to USDA today, so thank you very, very much. Thank you all very much.